Hi everybody, forgive me, I just got home from clinical, jumped in the shower and haven't done my hair yet, but I figure you probably won't mind it. Alright, so I'm going to do the legal, cultural, ethical first, and just going back over there, I know that we had talked about with cultural assessment and conditions, cultural conditions, so just again knowing that if your patient has a particular cultural, I don't want to say barrier or need, that may deliver your care or how it affects their, maybe the way they take their medications, different ways, health beliefs that they may have. Going back to, again, always asking about all medications, herbals, over the counter, in addition to prescribed medication, was very important. That's for everybody, not just with culture. We know that some of the, with cultural differences, that dietary can play impact it, religious practices, support for medical care. Go back over and knowing that about the clinical drug trials. So again, not so specifically that you have to know every single one of those phases. Again, there's 4 phases, and really it's the first one has a very small group, second a little bit larger, third larger, and the fourth isn't involved with patients. It's really the pharmaceutical company. What you do need to understand, though, is anybody who does participate in those clinical trials are required to sign an informed consent, and that they can pull out whenever they want to. So the informed consent really does need to inform that participant of the purpose, risks, if there's any procedures, and so forth. All right, I know we went over a few terms, so again, some of the legal terms that you'll hear throughout the program, and I think you talk about them in 117, is beneficence, which was doing or promoting good. So you're like, how is the patient best served? And then autonomy is really ability to act on one's own. So promote patient with autonomy as well. You can really help kind of empower the patient to help them make their own decisions too. You have veracity is a duty to tell the truth, and then justice is that you're being fair or equal. And in that regard, saying that you're fair in distributing the resources, or you're being fair and equitable in treatment of all patients. Okay, so the legal ethical was pretty straightforward. Again, with HIPAA, what is HIPAA? We know that that is the Health Insurance Portability Act, and that was put in place to really safeguard patients' medical information. And again, unless you are that nurse for that patient, you are not supposed to be in that chart. You're not supposed to be in a chart of anybody that you know just because they're in the hospital. And I can't remember the cutoff age, but I thought that if you have a child, and you can get in trouble for looking into your child's chart as well, but I can't remember if it's when they're 14. It's kind of young to me that you can get into trouble for looking into it.